going on, guys? Tony Maritato here. Welcome to the Knee Replacement Support Group YouTube channel. And in this video, I want to talk about the 3 most common things you're advised to avoid after a total knee replacement. So number 1, high impact sports, running and jumping, soccer, various high impact sports are often recommended to be avoided, primarily due to the concern regarding early implant failure. The idea behind it is the more wear and tear you put on the brand new joint, the quicker it's going to fail. Now, I had the good fortune of interviewing Dr. Abbott. Dr. Abbott is a surgeon local here in the Ohio area, and we talked about return to sports, return to running, and we talked about how person dependent all of those activities are. And to put out a blanket statement that says nobody ever after a knee replacement can return to running obviously doesn't take into account personal differences. So knee replacements are going into younger patients. I've been seeing patients in their 40s and 50s who've led an active, healthy lifestyle their entire life, now getting a knee replacement, and they want to return to recreational sports that involve running. And so there's absolutely a time and a place. And if you want, I will link to the Dr. Abbott interview that I did. But he talks about the difference between a cementless versus a cemented implant and how you can talk to your surgeon ahead of time to determine if you're going to be able to get back to running and higher impact sporting activities. The other thing to consider is, what kind of surface you're going to be running on. Certainly running on grass or artificial turf, running on a treadmill is going to be lower impact than running on asphalt or cement. Certainly, if you're a forefoot, midfoot striker as opposed to a heel striker, there may be some advantages to that. And different running shoes, different running mechanics. If you're a big runner, if you have a big body versus a smaller bodied person, these are all parts of the decision as to whether you're going to get back to running and sports in general. The second most often recommended activity to avoid is kneeling and crawling and work-related activities that require you to get down on your hands and knees and crawl around. Now, again, this depends on you, the individual. Depends on your age, your body type. It depends on the work you're going to be doing. Are you at risk for injury, not just because of the knee replacement, but, are you a first responder? Are you a firefighter? What are you returning to in terms of work? And are you putting both yourself and your team at risk? These are real questions that need to be asked. But at the basic level, is a person allowed to kneel after a knee replacement? Unless your surgeon told you for specific reasons that you individually are not allowed to kneel, depending on the implant, depending on the bone quality, bone health, other possible complications. For the general population, unless there's a specific reason you've been told not to kneel, most individuals after a knee replacement are allowed to initiate kneeling. Now, here in my clinic, what I typically do is we start kneeling on an 8-inch foam pad to reduce the fear and start to desensitize the tissue. I typically don't introduce kneeling until the incision is completely sealed and there's no sign of seepage or drainage. But there are videos on my channel in which you see patients who have had a total knee replacement progress and initiate kneeling. We usually kneel on a big cushion, then we kneel on a bed, then we kneel on a smaller cushion, until eventually they get to the point where they're comfortable kneeling on a carpeted ground. And the reason why I think kneeling is so important is because the reality is at some point there is a chance that you might fall. And if you fall, we need you to be able to get back up if you fall in a dangerous situation. For example, if I'm crossing the street and I fall in the middle of the street, I need to get up and get out of the way of moving vehicles. Or other scenarios where if I fall, I need to be able to get up and move. So kneeling is a component of fall recovery, getting back up off the ground. And that's why we always introduce kind of getting on the ground, getting back up, and kneeling in our rehab program. And then finally, the last component that's typically recommended to avoid is anything that puts you at risk for high impact or wear and tear due to repetitive actions. Now, this is kind of a part of the last two. It's part of running and jumping and impact like that, and it's part of getting down on your hands and knees. But repetitive motion, right? The implant itself is a very durable piece of equipment. But like anything, it will wear out over time. And what's important for you, the individual patient, to understand is you're going to make the decision on risk and benefit. Is it worth the risk of wearing the prosthesis out earlier than expected? Is it worth the risk of causing mechanical failure in the prosthesis itself, or potentially in the bone, or lack of healing? Or what I always try to bring to the table is say, look, what if you do everything right? What if you do everything right? You rehab well, you eat well, you sleep well, everything is going right, and you do something that you were potentially told not to do, and then something goes wrong. How are you going to feel? Are you going to blame yourself? What's going to be your personal reaction to that new situation? You know, I always have to ask the question, what if I only blank? How am I going to feel about it? That's something for you to consider, you know? So as much as I'm a huge proponent of staying active, a huge proponent of exercise and fitness and living the life that you want to live, I'm also as practical as I can be when I say, listen to your surgeon, have frank, open communication, ask these questions. What am I going to be allowed to do? What am I personally, with my age and my body type and my training history and all of the other stuff that's uniquely you as an individual, what are you allowed to do and not allowed to do, or at least not recommended that you do after your knee replacement? Because too often I talk to patients who don't have these conversations initially, and unfortunately it leads to frustration down the road when my client was thinking they're going to be able to do XYZ, and the surgeon was thinking you're not allowed to do XYZ. Guys, as always, I hope this content was helpful. If you want to learn more about what you're allowed to do, not allowed to do, how you can do some of the things that maybe you thought you couldn't do, go check out the blog post. I will post it in the comments below this video. I'll pin the comment so you can find the blog post easily, and I'll catch you on the next video.